in general, and they experience stigma themselves. So just thinking about and identifying some of the sources of discrimination in general that transgender people experience, like transphobia, the fear or disgust toward transgender people. Genderism, the idea that the stereotypical roles and rules around gender are the norm, and that everyone must adhere to those gender norms. And anyone who does not, anyone who is atypical or non-conforming, is abnormal or deviant. We'll be digging more deeply into transgender microaggressions a little bit later, but just to define them, negative or derogatory messages that gender minorities experience, and they can be a range from overt statements or behaviors, or more often very subtle, sometimes just innocent or unknowing in their delivery. Another real common experience for transgender people is the devaluing of their experience and stories, not being believed about their identity or how they identify themselves, and not being understood, not being respected, not being validated in who they are and in their experience as a gendered person. We also see discrimination in lots of areas of life for transgender people, and I'm going to be focusing on some data related to the area of healthcare and mental health care, because here's where we see some major contributors to the stigma around mental health in the gender minority population. Because transgender people sometimes experience discrimination when they're seeking help in healthcare or mental health care, that can contribute to a lot of stigma around healthcare providers and mental health care providers. So a lot of this information is coming from the National Transgender Discrimination Survey, which is created by the National Center for Transgender Equality, an organization that does a lot of advocacy for gender minorities. And this particular survey was conducted in 2011. It's a bit dated, but we have some more recent data from this organization also, because they do an annual survey, not focused specifically on discrimination, the annual survey, but this survey was focusing specifically on discrimination, again, in not only healthcare, but also other areas of life, housing, employment, etc. But this data, I'm sorry, just back to one more, back to that slide, Bob, thanks. This data is interviewing about 6,000 participants and asking them about their experiences in different areas of life, and this one particularly in healthcare, the experiences of being refused healthcare for particular needs. Was around 19%, experiencing verbal harassment, even physical assault. This kind of treatment happened in all healthcare settings, in hospitals, in outpatient clinics, in doctors' offices. And 28% said that the discrimination that they've experienced in healthcare led to them postponing seeking care. And this data is a little more recent from one of their annual surveys. Nearly a quarter of respondents experiencing problems with insurance related to their to being transgender and seeking treatment or seeking interventions. And again, another data point about how that affects transgender people in their seeking care. So disclosing transgender status to a healthcare provider, it's like a double-edged sword for many gender minority patients or clients. To identify as transgender, well, to be as forthcoming and as honest and as open as possible seems always to be the best course with a health provider or a mental health provider. But for gender minorities, it can open them up to discrimination, hostility, or just insensitivity or incompetence from providers. And so transgender people often have to kind of weigh the pluses and minuses of being open with their doctor or their counselor. And the prior experiences of discrimination contribute a lot to the stigma around mental health providers and health providers in general, and seeking care. And finding good transgender sensitive or transgender affirming care can be a real challenge for clients, and that can also be a big barrier to accessing services.
All right, Dr. Farmer has given some information surrounding the stigma. He also provided some definitions as well. I just wanted to go over just 3 types of stigma just to be aware of. Most people are familiar with the social stigma, you know, some of the stereotypes and whatnot that are out there. But the structural stigma, like kind of like the examples with the insurance and whatnot. Here's an example that what you might see is maybe there's a trans man that needed to go and get gynecological treatment. But since they're labeled, you know, male or as a man, insurance might decline, you know, this treatment or the claim, thinking, well, you know, what does a man need to get that type of treatment for? So it's kind of tough. You know, the person might have some challenges pre, you know, op or pre transition or affirming their gender or just throughout their journey, as well as afterwards when they have changed. So then having to out themselves, for example, to get health care too, that's another issue. The self-stigma, that is something that occurs like with the individual when they have been surrounded by this structural and social stigma. They start to believe some of the stuff and take on the negative attitudes and beliefs, and it could affect them in their daily life. So an example might be like, it might look like a Christian, for example, a trans Christian person who refuses to start hormone therapy or affirming their gender in any way because it's sinful, and maybe they'll go to hell. So that's just one example. So Dr. Farmer also provided the definition of microaggressions. So this is another definition that says that microaggressions are vehicles through which oppressive discourses are expressed through everyday insults and indignities, as well as unintended and unconscious demeaning messages toward non-dominant groups. So again, unconscious, you might not mean to. It's, you know, good intentions are great, have those good intentions, but they're not enough. Lots of the literature has shown that even when you have good intentions, these are some of the results that the individual could go through: chronic stress, depression, anxiety, lower self-esteem, increased number of sick days. Now, this is on top of everything else they're going through. So one thing to maybe be mindful of or think about or research is like the minority stress model. Definitely applies with transgender individuals. So although you might not intend to offend, incompetence, for example, can come across as a microaggression, or even transphobic too to the TGNC client. So it's about how they're taking how you're working with them. Now there are the three microaggression types: micro insults, micro assaults, and then the micro invalidation. And that's what Dr. Farmer kind of had mentioned earlier too. That one is the most subtle one. That's one that's kind of hard to catch at times. Now, you know, gender expansive individuals experience these microaggressions out there. Let's not have them experience them in your office where they are intending to find safety and comfort and support. Here's a little bit about the micro invalidations. These are those subtleties again. Now, this starts from the moment they're in your waiting room, in their office, or maybe on the phone call with you. So their impression of who you are, regardless if you say you're affirming or an ally, you got that ally sticker on your window or whatnot, that's great. Please have that. You don't have to prove your allyship. Please don't try to do that. But just be mindful that even if you've got that, if you're not quite comfortable, confident, and competent in these areas and treating transgender individuals, which is different than treating a person who is cisgender, who identifies with their biological sex and gender, it's aligned, you know, it's different, and who is cisgender and then maybe they are homosexual or whatnot. So it's two different things to be aware of. So here's some examples of what that might look like, first impressions, right? So your waiting room, what kind of stuff you have in there? What kind of magazines? What kind of literature? Did you use the pronouns that they use? What about your intake forms? Other than having female and male and then that little other box, why don't you just leave it blank? Let them write out how they identify, as well as their name. Like we started our presentation saying who we are. I said, I want to be called Bob. And we also identified our pronouns. We let you know what our pronouns are, that we use, that we would like you to use. It's not a preference. It is who we are and who we identify. The last one, directing your client who identifies as a trans man to the ladies' room. I mean, that is also quite devalidating. Here's some examples. Now, this is a brief example of a spectrum of identities. I mixed in a bunch of everything. I say brief because, again, there's huge lists out there. The literature has a lot. You're going to need to stay on top of it to find out what the culture says. But also, I want to let you know that not everybody who might appear or present or whatnot as transgender might label themselves with that label, transgender. That is a label that I use, that I identify with, but it's also normal for them throughout their lifestyle or lifespan to change their mind or find a different one that kind of fits them better. Maybe they're like, actually, I'm gender fluid. That's okay. It is something that's going to happen, and your willingness to be open and open-minded and receptive is going to really help them in their exploration of their own gender identity, which is something they need to steer and explore with your support, but it's their journey. So here's some examples. I also mixed in on the bottom there where it says heterosexual trans man / trans woman. Sometimes individuals who identify their gender as transgender, like for example, say a trans man was married to a cisgender woman, that trans man might identify as heterosexual. So just something to keep in mind.
I'm sorry, Bob, can we go back to that list?
Yeah.
Bob and I have talked a lot about this list and many other terms, and just in our familiarity with the population, we are still astounded by the number of terms and the new terms that keep popping up. And so I think, you know, it's a challenge for us to try to know and understand the terminology, but also recognize that these are identities, and that in general, identities are, you know, we create categories for them, and we used to have two categories, you know, male and female. And now that those categories are being expanded, you know, we want to do our due diligence of trying to understand the terminology as best we can, but also to learn from our client what a term might mean for that person. We don't want to be totally ignorant and have to rely only on the client to educate us everything about gender non-conforming people. So we do want to have a good knowledge base, but we do want to hear from our clients as well to see how a term like demigender, which we might not really be too familiar with, we do want to hear what a term of identity like that might mean for our client.
Absolutely, because what they think it means to them might differentiate for your Google you know, look up on the definition. So it's about what they feel and what they identify. And also keep in mind, just at a multicultural level, there's, you know, lots of cultures that see gender in different ways. Like we, you know, in the Western population here have the binary, but some of them have like 5. So it's just, it'll depend on that culture. Like, for example, I put two-spirit. That is something from a Native American culture and their beliefs as far as gender.
Our developmental lens will also help us in this regard, just knowing that people's identities change over time, and a gender identity might change over time as well. So, you know, how our client identifies at one point might be different from another time if they are in transition. And certainly the ways people express gender might change over time also.
Absolutely. So just because their expression as far as maybe like how they dress and whatnot doesn't necessarily designate who they are or how they identify. And something also just to, as a reminder too, sexuality or sexual identity and gender identity are 2 different concepts to be aware of.
Yeah, we have a whole other presentation on that. But all right, so we've talked about just this experience of discrimination and, you know, in general in society, largely from a lack of understanding, but a lot of kind of historical, social, moral teachings that have influenced people's understanding of gender and can sometimes limit or stand in the way of understanding and accepting a person who is transgender. That discrimination really contributes to the mental health stigma that we see, and these kinds of outcomes of gender minorities avoiding treatment or not being able to find good care. So we want to think about how, as mental health providers, how we can, you know, reduce that stigma and reduce those barriers to good care for transgender clients. And so we want to think about how, as individuals, we can be transgender affirming, and how our practice and our work can be transgender affirming, transgender sensitive. And so that's what we're going to be putting our attention to in the rest of this presentation. So in general, gender affirmation is an interpersonal process, an interactive process, whereby a transgender person receives recognition, support, affirmation, understanding for their gender identity and their gender expression. So again, remembering that these phenomena might change over time, how a person identifies, how a person expresses gender. We want to think about how we can affirm and support and provide sensitivity and understanding through those changes. So for the trans person themselves, there is an internal process of understanding and expressing their identity. And gender affirmation then is an interpersonal process where they receive that support and affirmation from others, from the people who are close to them, family, friends, community. And then certainly we want to think about it in the context of providing services. So some specific things are referring to the client as they wish to be referred to, with pronouns, with possibly an identity label like trans man or trans woman or whatever it is for them, and also by their name. And that name might change over time also, how they wish to be called. Being accepted in all of one's various expressions of gender. So again, remembering that this is something that might change over time. Seeing the person for who they are in all of the areas and the ways that they express themselves. And we know that through research, we know that people who experience good high levels of gender affirmation from the people around them, when they have good support systems, then the risks of some of those negative outcomes is much lower.
Thank you. Here's some definitions. Now, these are two different definitions, but pretty much say the same things. The second one is based off of doctors Annalise Singh and Dickey, and they do a lot of research with transgender individuals and transgender individuals of color as well. So if you read through this one, counseling is a culturally relevant and responsive to TGNC clients and their multiple societal identities. So also thinking back, they're not just transgender, right? They're also these other things. Addresses the influence of social inequities in the, oh, my screen got cut off, in the lives of TGNC clients, enhances TGNC client resilience and coping, advocates to reduce systemic barriers to TGNC mental and physical health, and leverages TGNC client. This definition is kind of what we've been working a lot of our research and whatnot, and from Annalise or Dr. Singh and Dr. Dickey. All right, so here's a little bit more about what they have found that is helpful. Some stuff you're probably already aware of, like, how good of a fit is your personality and your style and your approach. That's going to be general with anyone, right? But there's some other things to consider, like your proficiency. This is great. You're gaining some more knowledge. You're gaining more competency in working with gender expansive individuals, but are you proficient in working with youth, for example? If not, well, then maybe, referring would be a good idea. The other example here is like office location, and we already talked about office environment, location and fee setting. Unfortunately, individuals who identify as trans, many of them are, in the poverty level, They might have risk factors like homelessness and suicide as well. And getting to your office might be a challenge because of their finances, as well as paying for your services. So these individuals, you might want to consider things like maybe Zoom or something that is secure to do some individual therapy with them that way, as well as just you're maybe having a sliding scale. Just an idea, an example. Definitely also applying a trauma-informed lens. The majority of the individuals that I have personally worked with who identify as TG, they had some form of trauma, whether it's the big trauma or some little trauma, right? And a lot of what we worked on was actually more of those things that were contributing to their symptoms and the challenges in their life, and less to do about their gender. So one thing, we'll discuss a little bit more as well is not assume. Don't assume that they're there just to work on their gender issues or journey or whatnot. It could be other things. So here's a little bit more on that about building your competency. So your competency in working with multicultural, period, but with transgender individuals. So definitely the literature as well as just in general, yeah, start with yourself. Start with gaining some personal awareness in exploring your biases, assumptions about people of this culture, and just stereotypes that you might have. I mean, it's kind of challenging. There's media, right? Media is showing and talking about people like me and giving this idea. And sometimes it kind of can give us an idea that we're okay, that we're safe. More people are learning about us, and that's not true. There's like multiple deaths per year that are generally hate crimes and whatnot happening. Even in 2020, I think we started off with 8 already. So understand, again, the differences between sexual identity and gender identity, and that those may change. I really like number 3, be aware of your curiosity. So the literature also has shown that individuals of the dominant culture tend to have like a voyeuristic curiosity, and just remember why you're there. You're there for them. Learn maybe separately. You can learn with your client. Sure, that's different. That is okay. Just be mindful of some of the questions you're asking and what you're hoping to get out of and how it pertains to their treatment services. So it's balancing between I'm competent, but yet I'm helping to, elicit exploration of your journey that may have to do with your gender or may not. Definitely identify some local resources and national as well. So you can have some referrals. You're going to also need to get comfortable with working with medical professionals to coordinate care, because some individuals might either need you to advocate for them, for example, or they might need to, or maybe they decide they do want hormone treatment, or they do want surgery and so on. And you need to know who those people are in order to refer. So as well as treating, think about the whole person. So many of the individuals, in addition to trauma, they also had some substance use challenges. You want to be comfortable with anxiety disorders, mood disorders, and some of that is not necessarily just because of the gender challenges or the journey that they're going through or the stigma they receive. It's just in general, right? Everyone has stress and everyone has anxiety. Well, not everyone, maybe not everyone. Sorry, I'm generalizing here. But, sorry, caught myself. But, individuals probably could relate with that. So we have that minority stress again. But individuals who identify as transgender in general do tend to have these symptoms because of what they're going through as far as their gender. Even just the thought, the idea of if I'm outing myself, or if I go out in public or whatnot, and I maybe receive the wrong pronoun, or am I going to get hurt today because someone's going to find out that I'm really not a man, for example. Practice the basic skills. Those basic skills will take you far. Reflective, active listening skills, validation. Again, we talked a little bit about invalidation. So validation definitely is very important. majority of the individuals, again, that I've worked with, we worked on their gender as well, but they reported back to me that what really helped them is they felt heard, they felt respected, listened to, and they felt non-judged. So it really helped them in opening up more to the process of the therapy.
Another important direction for us as providers to think about is, in terms of being gender affirming, is social justice advocacy for our clients and for the transgender population in general. So the advocacy competency domains can assist us here as we kind of think about what our role is and what our competency level is, and how we might want to intervene in any particular social justice advocacy act. We can think about the axis of the range between how deep we want to intervene or advocate for our client, whether it is acting with our client, empowering our client to take action or to make statements for their own affirmation, or whether we're acting on behalf of our client, assisting them in a behavior or in a statement that they might not be able to say or have not been able to be heard. We also need to consider our role, and that might be affected by the setting that we work in, that we see our client. What kind of support do we have to take action in advocacy for our client or for a larger group like the community or the population? We definitely need to consider the relationship we have with our client and what kind of help they are seeking, and what kind of trust we've built to be able to intervene in this way. It's also important for us to consider our competency and how ready are we to do advocacy steps? How ready are we to assist in this particular population in terms of our knowledge base and our understanding of the issues? As Bob mentioned, knowing resources in the community is extremely vital in terms of partnering and providing comprehensive care for clients. And also just a basic understanding of the kinds of medical treatments that gender minority population might be seeking, cross-sex hormone therapy or gender affirming surgeries. And the process for transgender people finding providers and accessing this healthcare has changed a lot over the years. The WPATH has created guidelines for providers. WPATH is the World Professional Association for Transgender Health. So it is across specialties, looking at all the areas of transgender health. Guidelines for transgender people to access these kinds of therapies have changed over time and sometimes have included a role for mental health professionals as kind of a gatekeeper to whereby clients would have to have a certain number of months or a certain period of time expressing their gender in a specific way and a certain length of time in therapy. And counselors and other mental health providers had to provide documentation for that therapy for the person then to receive some of these treatments. So we might have providers who still use those guidelines, and then other providers, medical providers, other providers are leaving it up to the individuals themselves to make those choices and not requiring a mental health treatment prior to medical treatment. So it's important to know who the providers are in your community and kind of what the processes might be for clients to access consultation and or treatment. We live in a pretty large metropolitan area here in Phoenix, and there are a number of support organizations for transgender people, a pretty strong community, and some excellent healthcare providers also. And so this is something you're going to want to find in your own community, or what's nearest if you're not in a major metropolitan area. And then also some national resources. So the National Center for Transgender Equality, which I have linked here, was the source of that survey that we looked at earlier. And they're also just a wealth of resources for legal support, for advocacy support, for transgender clients.
Absolutely. So as far as the WPATH, just to touch a little bit more on that, the standards of care recommend therapy, but it's not a requirement. So as an individual may or may not begin their process of affirming their gender, some people still say transition. I say transition, but the language is changing, and it's affirming. So generally I try to say affirming their gender when I'm talking to professionals, because we as a professionals are the ones that are kind of putting it out there, like the language to use and whatnot. So listening and hearing how your client talks about themselves and what they want, instead of generalizing as well, it's going to be helpful. So you can also, part of our role too, the coordinating of care. So you can ease some of that discomfort, getting in touch with these different other individuals that might be involved in their treatment services.
Bob, we had a question here about recommendations on sources to learn more about diagnosing and treating gender dysphoria. And I'm going to have to look for that, and I can help you out with that, Brian. But in general, the DSM criteria are helpful enough just in terms of to make the diagnosis, to understand how a person's disconnect between their gender identity and their sex assigned at birth is impacting the client. And if we see it impacting the client in these negative ways, anxiety, depression, etc., then they might meet the criteria and receive the diagnosis. Again, we want to think about diagnosis from a larger context too, and how the diagnosis is impacting the client. For a long time, it was a very stigmatizing label, and the DSM-5, I think, has really helped by changing some of the terminology. But any DSM diagnosis is stigmatizing, and so we want to think about how our client is going to be receiving the diagnosis and understanding the diagnosis. And then in terms of treatment, it's really looking at symptomology. Is it about, are the symptoms more anxiety, or are they more depression? And also the treatment is going to be paying attention to these larger contexts. What are the specific things in this client's life that are that are impacting their mood or their affect. You know, it might be relationships with family members, or just the daily discrimination or microaggressions that they experience at work or in life, or their challenges accessing good care. And it's treating symptoms, but also addressing those real life needs to be gender affirming to the person.
Absolutely. Another thing is to, you know, balance between assessing for like in a comprehensive way, but also maybe touching on a little bit of that gender journey. So for example, if I was working with a child, one of the things that I'm going to be looking for is what is consistent and persistent. So throughout the developmental stage. So that is something to also consider, like if you're working with children. We have a separate presentation though that we do working with youth. If you're interested, we can probably provide you some information if you email us. All right, so here's a little bit of the do's and the do nots. We talked already a little bit about what is needed and what can help. Please help us normalize this. Like we introduced ourselves and saying like the pronouns we use. If we introduce ourselves like that, that's going to show competency, right? But never assume that they want to be called like they, for example. This is definitely kind of can be harmful, especially it kind of shows that maybe you're uncomfortable, maybe you don't quite know. Just ask what pronouns do you use? And just like that, we like to use the word, oh, I wanted to mention it, PGP. PGP actually used to stand for preferred gender pronouns, but we've gotten rid of that word prefer because it's not an option. It's who we are, and what we in order to honor and respect us, this is what we use for ourselves and want you to use. So we say words like refer. How do you refer to yourself? What gender or what pronouns do you use? We also want to be mindful of the level of outness the individual that you're working with is. Like you're going to need to coordinate care. So it'd be great if you do like sort of pass on, you know, I usually ask my clients permission, like, is this okay that I let the front office know? Or is this okay that I, whatever, and I personalize it, I introduce, I'll say, hey, this is so-and-so, that the name that they use is this, and I'll say he or she or whomever, what I'll use the pronouns as I'm talking with them. And then that way everyone is kind of, they know. So I let them know. Sometimes what we do is in our service planning, we will write, you know, if the individual says, you know, I want to be called this, I use these pronouns, you know, if they're an adult, is it okay that I write that on there? So that when you say you work with another clinician, they can see that and know, oh, you know, so we're all aware. Yes, absolutely. I usually only do those though. I do those things with their permission. So let's see. You can, when you're like greeting people and there's several people, stop using ladies and gentlemen. Use things like folks, or I say y'all. I don't know where I got that, but I do. I say y'all, and or friends, for example. If you goof up, like say you're called them he, and they use the pronoun she. Well, okay, well, just correct yourself and move on. Don't make a big deal about it. Don't make a scene. Don't focus on it, okay? It's okay. We're all learning. I still have people that call me she, and that's okay. I'm okay with that. I'm comfortable with it. You know, we just move. Yeah, Dr. Farmer sometimes does that, and that's okay. You know, I'm okay. I'm comfortable. Not everyone is at the acceptance and whatnot level that I am, and I understand that I'm kind of in the middle of my transition, so it's logical that I still get called she every now and then. That's how I work through it. So again, balancing your approach, you know, between how do I like talk about this journey, but not focus on it if it's not something they want to focus on. Other thing to know, just in some of the language that the person might use, is dead name, for example. That is the birth name that they were provided. So they might say, stop using my dead name. I don't want to go by my dead name, for example. And let's see. I think that's all I wanted to say in this slide. How about you, Dr. Farmer?
No, those are all fantastic, fantastic specific tips. Yeah.
Thank you. Thank you.
Appreciate that.
Thank you. All right. Sorry, trying to get this to work. Here we go. So I talked a little bit about Dr. Singh and Dickey. They have another book that they came out with in 2018. It's really great. It's the clinician working with gender expansive. I got the resource at the end. I forgot the name of it offhand. Sorry, but these are the approaches that they or the interventions that they recommended. I have used definitely mindfulness-based techniques. I personally have used EMDR as well. I'm an EMDR practitioner, as well as CBT, and it's been very helpful. Again, it's not always about the gender, for example. The mindfulness based techniques were helpful in helping to ground the individual, because I noticed a lot of the individuals I've worked with had a lot of dissociation symptoms or dissociative symptoms because of some of the trauma they've experienced, and some of it was based around their gender, for example, and other things as well. So just some things to be mindful of. Here's a list of some of the resources that we've used and that we recommend that you kind of review and look over. Dr. Farmer already listed some other things. We mentioned the WPATH, standards of care, and then the other one that he mentioned, the national, what was it again?
National Center for Transgender Equality.
That one. That was a good one too. I can't remember all of them off the top of my head, but there's a lot out there. There's a lot more nowadays than there was 20 years ago when I was exploring this as a younger person. I know I look really young. Thank you. The other thing I would recommend is learning more other individuals who identify in this culture and their stories. You can read books, you can watch movies like Boys Don't Cry, the story of Tina Brandon. That one is a really good and unfortunate. It focuses a little bit about the hate and the stigma as well, but it's a good movie. I like that movie. I definitely, anyways. So there's books out there, there's movies. I want to save a little bit of time since we're running out for some questions. Anything else you want to add, Dr. Farmer?
I'm just going to make an announcement that we will be submitting these slides to the Chicago School of Psychology, and then they will be making them available. I don't know exactly how or where. I don't know if Lori Ann or Dr. Stretch, if you might know that.
Sorry, I was reading something else. I'm knowing what.
I'm sorry, on knowing how the slides will be made available by.
Yes, we haven't quite worked that out yet, but we are going to make them publicly available. So if you or Bob could send them to us, we will make sure that they get posted. We're going to have the recording and the presentation slides if possible.
Great, thank you.
Thank you.
Yeah, and we do have a few minutes left, so we're happy to address any questions through the chat, or if you want to speak up. Oh, I did see your question, Linda, and it is a very good question. If we don't want to use the word folks in a more formal setting like a wedding, what is a way to address a crowd without gendering?
Well, I mean, I would use friends and family.
Mm-hmm. Friends and family.
There's a question about healthcare programs that are friendly. There are some. There is a website, I can't think of it off the top of my head, that does give a list of the different healthcare providers that support like sex reassignment surgery and whatnot. And I know there is a plan under Blue Cross Blue Shield that does assist and help people to affirm their gender.
Transequality.org is the website for the National Transgender Equality, National Center for Transgender Equality. And they address that also, healthcare providers that are supportive of gender non-conforming clients.
Anyone else? Also, you see here our email addresses. Please, I welcome any emails, any feedback that you might want to give me personally regarding our presentation. I thoroughly enjoy doing this. It's part of my way to advocate and support my own culture. And I definitely want to get better and better. So if there's something that we missed or something you wanted more information on or whatnot, please email me with that. Or if there's anything else, any other resources that you want some help on for us to provide, feel free to email.
Em is asking about any formal assessments for diagnosing gender dysphoria. I do not have any.
I don't have any either. But I know we've been to conferences, like we had recently gone to a LGBTQ conference, and people are working on that. So that might be something, maybe a project for yourself. Like, you know, I would totally support that, right? I mean, if you see a need out there, let's get together. Let's try to create this. I'm open to that. You know, email me. Maybe we can figure something out. I definitely want to be able to support as much as I can. So these are really great questions. I'm just looking through the questions. Thank you so much, everyone. I hope you enjoy the rest of your program. And it looks like they were able to get this recorded. So if you need to play it back, I think they're figuring out how to get availability to this recording.
Yes, we will be. So thank you again, Bob. Thank you, everybody, for being here. We love doing the virtual conference every year. So I'm just so excited to see so many people here. And we will have other sessions starting in about 5 minutes. Bye. Thank you.